Today, authorizations are very cumbersome, manual, and inefficient. For payers, working authorizations can cost upwards of $45 per transaction. Cognizant and the New England Healthcare Exchange Network collaborated with Harvard Pilgrim Healthcare to streamline and better automate the prior authorization process for payers and providers. The result of this collaborative effort is Cognizant's TriZetto Touchless Authorization processing solution, which was piloted at Harvard Pilgrim Healthcare. This automation solution holds benefits for both payers and providers. Payers are able to automate and integrate both business and clinical rules to eliminate manual workflows. Providers can automate eligibility checks, identify if authorizations or referrals are needed, then receive an immediate, fully automated response.
At Harvard Pilgrim, we have the business goal to, again, do as much provider self-service as possible.
The more automation we can do with prior authorization, the better and quicker response we can provide to the provider.
We can take out a lot of that gap and a lot of that time and the manual nature that it is today, where we do a lot of faxing, a lot of phone calls, a lot of provider reviews, doctor reviews on our side of what's appropriate and what's not.
When NEHEN came to us and said, we have this idea of a pilot working with what is now TriZetto TTAP, would you be interested? And we said, absolutely.
Pretty much a cloud-based solution, and it allows very easy configuration of new rules and policies.
Had 83% of our transactions for authorization requests in the pilot were touchless, where the provider was able to enter the information, look at the member's eligibility, enter the information, and get a response of an actual authorization in hand. In particular, we've had one provider that has just flat out said, it used to take me a week to get an authorization in place, and I now have it in 15 minutes. That's an enormous savings. Forget about the health plan, think about the provider.
The tool will help us in the future by enabling us to focus more on the higher order pieces of the healthcare continuum, and we're excited about taking the next step to further the relationship with these tools and capabilities.